Good evening and welcome to Dr. Strand's webinar. The topic tonight is on Dr. Strand's approach to autoimmune disease. You've made a wise choice to be educated by RX's Chief Medical Officer. My name is Shauna Sheets, and it's my honor to introduce to you our speaker tonight, Dr. Ray Strand. Dr. Strand is a graduate of the University of Colorado Medical School. He finished his postgraduate education at Mercy Hospital in San Diego, California, and he's been involved in a private family practice for 40 years, focusing on preventative and nutritional medicine for the past 17 years. He is the author of several books, like What Your Doctor Doesn't Know About Nutritional Medicine, Death by Prescription, and Healthy for Life. All of his books have been translated into several languages. In fact, What Your Doctor Doesn't Know About Nutritional Medicine has been translated into 20 different languages. He's lectured on preventative and nutritional medicine across the world, and Dr. Strand is quickly becoming one of the world's leading authorities on nutritional medicine. We are so blessed to have Dr. Strand as our Chief Medical Officer at RX. I'd like to add that Dr. Strand's passion to help others is genuine, and that is why he is committed to hosting these webinars and calls to educate us and provide us the tools we need to help others. As you know, RX is an opportunity company, opportunity to build the lifestyle you've always dreamed of, and the opportunity to be healthy and available for your family. During tonight's call on autoimmune diseases, Dr. Strand will answer a few questions from you. Please type those into the field and stay tuned at the end. Without further ado, I'd like to welcome Dr. Ray Strand.
Well, thank you, Shauna. I really appreciate that introduction, and I'm just thrilled to be here tonight with you to talk about my approach to autoimmune diseases. You know, since I have switched and focused my practice on nutritional medicine, I'm amazed at the clinical results I'm getting in my patients who have and suffer from autoimmune diseases by allowing them on an aggressive nutritional supplement program. And I just want to share tonight my approach, really the way I have found helps my patients the best. And so what I do is I'm going to go ahead and just review some things for those who may not know that much about autoimmune diseases. But you need to understand, and I think most of you realize, that our immune system is really our great protector. You see, the immune system's job is to continually be checking for self and non-self. So when it finds a foreign body or a non-self, a virus, a bacteria, or even an abnormally growing cell, its job is to destroy it and rid it from the body. The weapon it uses is actually free radicals. In other words, our white cells, our immune cells, actually creates oxidative stress, which is this inflammatory response which allows it to destroy a virus, a bacteria, or a foreign body. This is the good side of oxidative stress, if you've heard me talk before, in regards to, all of the chronic degenerative diseases that we have. So it's really important to understand that our immune system is going around checking for self, non-self, and if it finds a non-self, it destroys it. That's the way our immune function is to operate. And so that is what we're trying to do. Now, I was taught in medical school that if any of our patients develop an autoimmune disease, that they really had an overactive immune system because now it was attacking self. So this is what I was taught. So instead of the body destroying a foreign invader, a virus or a bacteria, it is now destroying normal tissue. So the type of autoimmune system that you might have depends on which part of the body it's attacking. So if it's the joint space, you end up with rheumatoid arthritis. If it's the myelin sheath around a nerve, it is called multiple sclerosis. If it's your bowels, you can end up with ulcerative colitis or Crohn's disease. If it's the spine, it's ankylosing spondylitis. If it's the connective tissue, you could end up with lupus or scleroderma. Sometimes Sjogren's attacks our salivary glands. the thyroid gland is attacked in Hashimoto's thyroiditis. And yes, even type 1 diabetes mellitus, or what we used to call juvenile diabetes, is really now found to be an autoimmune response that attacks the beta cells, or those cells that produce insulin in the pancreas. So that is what autoimmune diseases really are. And what is so frustrating is that here our great protector has now become our greatest enemy. And so traditional medicine looks at this as an overactive immune system. Therefore, its whole approach is to suppress the immune system by using very, very potent drugs, chemotherapeutic drugs. We start to see Enbrel and all these drugs for rheumatoid arthritis, or methotrexate. Very common for people and doctors to use steroids like prednisone. Or all of these anti-inflammatories, just trying to suppress the immune system. And of course, all of these drugs have tremendous side effects and problems because you're suppressing the immune system, so now you're more vulnerable to infection and virus and actually increase your risk of developing cancers and all that. However, this is sometimes a choice people have to make when you're suffering from one of these very difficult diseases. So what I've learned in the last 17 years is the fact that I don't believe we're dealing with an overactive immune system as I was taught in medical school. I believe that we are dealing with a confused immune system. You see, our immune system is out there. It should be recognizing self and non-self. And when all of a sudden we start attacking self, it's not overactive, it's confused. And so this is a critical distinction when it comes to nutritional medicine. Because if the body's no longer able to recognize self, then to me it's confused. And to deplete it and to go after it is not the right approach. However, I have to tell you, I never take patients who come into me after seeing a rheumatologist or the neurologist, or, they've put them on their medication for these autoimmune diseases. I'm not worried about that because my approach is not medicinal. All I'm doing is building up the body's natural defenses. But what I have been amazed is with the results that I'm seeing in my practice. So what I do is I place my patients, I continue on their medications, on aggressive nutritional supplementation regime that actually optimizes their body's natural immune system and their natural antioxidant defense system. You see, the reason that I do this is that in all the study, in all the medical literature that I reviewed for the last 17 years, for example, if you look at Crohn's disease that attacks primarily the small bowel, when they do studies and they look at the small bowel of a patient with Crohn's disease, their antioxidant defense system is dramatically depleted. If you look at someone with rheumatoid arthritis and you look at the joint space, the tissues in that joint space, their antioxidant defense system is totally depleted. Because it's being attacked by the immune system, it's creating oxidative stress that's damaging normal tissue now. It's not destroying a virus or a bacteria. It is now destroying normal tissue, the joint space, the myelin sheath of the nerve, the bowels, the connective tissue. So what happens is when you actually start an aggressive nutritional supplement program that I recommend, you're actually building up your body's natural antioxidant defense system. So that even if the body's attacking your immune system or part of the body or normal tissue, there's less damage that occurs because you're building up your antioxidant defense system, which allows better protection of normal tissue. But here's what a lot of people don't realize, that you're also, the same nutritional supplementation I recommend for building up your natural antioxidant defense system builds up your natural immune system. Now, in someone that's 30 years or younger, that takes 6 months to do. If you're over 30, studies show that it almost takes a year to build up your natural immune system. But what I find is with the results that I'm seeing in my practice, I actually see patients just doing wonderful, but it takes 6 months. I'm just going to share some examples just to give you an idea. When I first started in nutritional medicine back in the 1990s, I had a Native American lady come in to me who was suffering from scleroderma. She was actually sent home from the University of Colorado Medical School, my alma mater, where she was being treated. She was sent home to die because her scleroderma was so bad. It had infiltrated her heart, her eyes, all of her tissues. She was short of breath. She couldn't breathe. In fact, when she came into my office, she had to stop about 3 or 4 times to get into my exam room because she could only walk about 6, 8 steps without this happening. And she just said, I've heard what you do. I want to just try anything because they've given up on me. So I went ahead and started her on my aggressive nutritional supplement program, and I saw her each month. And I have to tell you, month after month after month, there was absolutely no improvement. And however, at 6 months, she came in to me and she says, Dr. Strand, I know what's happened. I just got back from my ophthalmologist, and I couldn't see. It was like a waterfall. And I had glaucoma. I had hemorrhages in the retinas of my eyes. He said, that's all gone. I got 20/20 vision. All of a sudden, I could see. And the other thing is, I'm now out at our mall indoors. I'm doing a walking program. I'm walking about 1.5 miles a day. And I'm sitting there. I'm dumbfounded. I had never seen this. Well, then I start to go to a conference, and I'm starting to speak, and I had a lady walk up who had MS, and she tells me she was basically not wheelchair bound, but she could only stand with a walker, and then only for a few minutes. And she got on aggressive nutritional supplement program, and after 5, 6 months, she was able to walk. She could feel the grass under her feet. She was running upstairs. I had never seen this. In fact, when she was telling her story, I was sitting with 3 other physicians, and we looked at amazement because we'd never seen this in medicine. You don't see people with MS improve like that, not once they get down that far. And even on the drugs that they take, the beta-seron, Copaxone, all these, all they tell them is that the progression of their disease will slow down. Well, when I was talking in Rapid City, South Dakota, I had a rancher come in who was a roper, and he heard me talk about MS and autoimmune disease, much like a lecture I'm sharing with you tonight. And he said, I have MS, and I'm a roper, and I can't feel anything from my waist on down. I have no feeling. I don't know where my legs are. I don't know anything. Now, my strength hasn't gone, but I have no feeling. He says, do you think what you're doing would help me? And I said, well, it's worth a try. Not everybody responds, but some do. And if you happen to respond, what's the harm of trying 6 months of what I recommend? Well, within that 6 months, he actually came back. He lived in a town outside of Rapid City in Sturgis, South Dakota. Came back to me and says, Dr. Strand, you won't believe this, but all my feeling has come back. And in fact, he said, he became my patient, obviously, after that, and I followed him for 4 years. He didn't have any symptoms. And he kept telling me, I think I'm cured. I think I'm cured. And I says, no one's ever cured. People, my lady still had scleroderma. The people still have MS. You still have MS. Well, he didn't believe me, but the next spring, his neighbor rancher got sick, and he was calving for both himself and his rancher friend, and came into me and says his numbness was starting to come back. And I says, man, this is not wise. You can't stress yourself that much. But we got him back on. He did well. And I've got story after story. I've been involved with probably over a dozen MS patients who have actually gone from wheelchair bound to walking again. And I've followed them for years. My dentist wife, she had MS. She was one of the first people I got on after I started seeing these results. And, she didn't have much problem. You couldn't tell she had MS. But, it's been 17 years now, and she has not had any setback. You wouldn't know. She's lived a full life. She's never had any problems with her MS. In fact, went back this last fall and had another MRI, and the neurologist said, if I looked at this MRI today, I would not diagnose you as having MS. But I know you've got it. And, she still has some problems. But the body has a tremendous ability to heal itself. But what I am telling you, I have stories in lupus. I've had lupus patients go in and actually within 5 or 6 months be able to improve so much that their doctors take them off their medication. And in fact, I was doing a conference And I was signing my books afterwards, and within 30 minutes, I had 4 different ladies. They happened to be all different. They all happened to be ladies who had followed my online recommendations for rheumatoid arthritis. And the 4 ladies all said, I followed your recommendations, and after 6-8 months, I did so well, my doctor took me off all my medications. In fact, my sister, my younger sister had rheumatoid arthritis, and she knew what I did, but she wouldn't take the nutritional supplements I recommended. You know, family's the worst in the world. She wouldn't even believe me, but she finally got so bad she trusted me, got on the nutritional program I recommended, got on a gluten-free diet, got in some of the other things that I add when I do this, and it turned around. She basically got off her methotrexate. She got off her prednisone, and lo and behold, she's able to walk again, do this, but it was under the direction of her doctor. You see, I never take people off their drugs, but if their physician sees that they're improving enough, and so it's always from a positive that they want to decrease or discontinue any medications, it's up to them and their doctor, and that's very, very important. We never take anybody off their medications. We don't present it, or I don't present this as a treatment. It's not alternative medicine. It's complementary to what they do. I find actually people who are on medications actually respond to the medicines better. They tolerate them better. I always find it interesting. When I first started doing this, you know, almost every rheumatologist, a patient comes in with rheumatoid arthritis, they automatically, before they walk out, they were on methotrexate. And they would look at you and say, oh, you shouldn't take any folic acid. Get off that stuff Dr. Strand's recommended. Well, it wasn't too long after that in the Annals of Internal Medicine, they had a study come out where they looked at people taking methotrexate with rheumatoid arthritis and folic acid. They thought it was the folic acid. And they found that the people who took the folic acid and the methotrexate actually did better. So now it's funny, any rheumatologist that prescribes methotrexate, the next thing they do is they write out a script for folic acid. So, you know, this is complementary. You can do this as you go ahead and continue, you know, the traditional treatment. So let me just share with you that we're not so far off base. See, in my early years of my practice of medicine, we treated MS by using chemotherapeutic drugs and steroids, prednisone. We'd give them bursts of steroids. But we learned that these drugs just did not work. They weren't effective in helping our patients with MS. So now we've come out with drugs that actually build up our immune system, the interferon-like drugs like beta-seron, Avonex, Copaxone. Now, these drugs actually build up your immune system. So what's so amazing to me is we're doing the same thing, only we're doing it naturally. So if someone wants to take beta-seron and Avonex and Copaxone, or if they've been on for years, they know what the drug's done. So I don't mind starting my recommendations. They follow my online recommendations for that particular disease. And if they see improvement, and like I said, not everybody responds, but I'll tell you, a good percentage do. And if they do, they know it's not their Copaxone or Avonex. What it is, it's the nutritional aggressive medicine that I practice. And so that's what's exciting. So my approach to autoimmune diseases is to build up the body's natural immune system instead of using these potent drugs that have these numerous side effects. And it becomes less confused in my mind. Also, at the same time, you're building up the body's natural antioxidant defense system, so any attack that's going on by the immune system is, you know, your body's better protected, so there's not as much damage. So we're actually hitting both sides of this whole process. So my basic approach to all autoimmune diseases, now I may vary it a little bit on the amount that I use because I've learned, like my MS patients need a little more grapeseed extract. My rheumatoid arthritis patients don't need as much. But I recommend all of my patients that have autoimmune diseases begin what I call cellular nutrition. I define this as providing all of these essential nutrients at these optimal or advanced levels, those levels that have been shown to provide a health benefit in our medical literature. Now, I add to that because, let's face it, people who are suffering from lupus or scleroderma or MS or rheumatoid arthritis, they have much, much more oxidative stress and free radical damage and inflammation. So I add enhancers like the grapeseed extract, which not only is probably the most potent antioxidant that we know today. It's 50 times more potent than vitamin E, 20 times more potent than vitamin C when used with cellular nutrition, especially vitamin C. And not only that, but it readily crosses the blood-brain barrier, so it gets into the fluid around the brain and nerves. That's why it's such a critical nutrient in MS patients. But it's also a tremendous natural anti-inflammatory. And I use that aspect. So I use a lot of grapeseed extract in these patients. Now, that's the same reason I use fish oil. Fish oil contains the omega-3 fatty acids, the essential fatty acids that actually become your body's natural anti-inflammatory products. Now, we need anti-inflammatories and we need inflammation, but in the case of people who suffer from an autoimmune disease, they have way too much inflammation. Now, I also know that most of my patients are deficient in vitamin D, so I recommend they get a vitamin D blood test, and I'll add additional vitamin D. But here's what a lot of people do not appreciate. The most potent builder and optimizer of our immune system is CoQ10. I have talked to Dr. Peter Langston, who's the head of CoQ10 International, and not only do we use CoQ10 in heart failure and that, but it's now being used in about 12 clinical trials involving cancer patients. But what I've found, the reason they use it in cancer patients is it builds up the immune system. Remember, I told you one of the jobs the immune system has is to check out for abnormally growing cells and destroying it. Now, out of the University of Florida, one of these studies, the preliminary reports are coming out that CoQ10 also sets off natural cell death. We have a fancy name, we call it apoptosis. But what happens is that the cancer cells start to die spontaneously. But I find it's tremendous in my autoimmune patients. Now, I don't have to use as much as I do in my cancer patients or my heart failure patients, but I use CoQ10, and they have to take all of this together. And here is the key. I have learned that it just takes time. I don't want any of my autoimmune disease patients doing any of my recommendations unless they're willing to commit to me that they'll take it for at least 6 to 7 months. Then they know if they're going to get a positive result or not. I just have learned it with autoimmune diseases. It just takes that long to build up your immune system. So that's really what we're doing. So if you want to learn more about the best way to maintain or regain your health, consider getting a copy of my book, What Your Doctor Doesn't Know About Nutritional Medicine. I explain this. I actually have a whole chapter in this book on autoimmune diseases. And now I'm going to turn it back to Shauna. She's been very willing to help me host these webinars for you. And so I'm going to let Shauna close this meeting, and then we'll go ahead and answer some of your questions.
Thank you, Dr. Strand, and thank you so much for joining us tonight. Before we begin your questions, I do want to talk with you about Dr. Strand's website. It's been developed to assist us as RX reps take care of our family and our customers. On his site, www.healthconceptsint.com, you can access Dr. Strand's specific RX recommendations for over 100 diseases and share those with family and friends and even potential customers via the consult feature. You also have access to a wide range of articles and videos explaining the health benefits of taking high-quality nutritional supplements. If you are among the thousands of RX reps desiring to improve your own health, you can join his 12-week Healthy for Life program. This will take you by the hand and guide you into the healthy lifestyles that will optimize your weight loss and the health benefits from RX's weight management system. The cost for his membership is $49.95 for the online medical practice, and the 12-week basic Healthy for Life program is just $29.95. However, as an RX representative, you receive 1 year of his online medical practice for just $39.95. You can also get your first month free of the 12-week basic Healthy for Life program, so you only pay $19.95 for the entire 12-week program. For all the details and to sign up as an RX rep, you'll want to go to www.healthconcepts.com/RX. Again, healthconceptsint.com/RX. We are now going to answer